Hello and welcome to yet another episode of Body Garage with I, Sheila Chelangat. And on this episode, we delve into diabetes. What is it? What are the causes? And how can you prevent it? And taking us through this topic is Dr. Stella Kibet. How are you?
Hi.
And also in studio with us, we have youth who have said, I introduced them as diabetes champions. Hi guys.
Hello.
How are you doing?
We are good.
Kopoa?
Yes.
All right, Dr. Stella, let's begin with the ones and twos. What is diabetes?
So diabetes is a blood sugar disease. It's what we call an autoimmune condition where your body fails to produce insulin as it should. And because of that, you have a problem with blood sugar control.
Mm-hmm. Okay, so what is insulin? I've heard you mention insulin. What is it?
So insulin is known as a hormone. We know for the body to function, there are many things that help it to work, and one of it is what we call hormones. Hormones help in some of the body functions. For example, blood sugar control. Okay, when you eat something, there's a way that your body is supposed to take up the food, convert it into glucose, which can produce energy for the body to be able to function for all the bodily functions. So insulin is one of the hormones which the body needs in order to regulate the amount of glucose that circulates in your blood. Mm-hmm. So for example, when you eat a high starch or high carbohydrate load, you find that without insulin, your blood sugar will rise so much, and this can have effects on the body. So insulin, in summary, is a hormone which helps us to regulate so that you don't have an excess of glucose in your blood and not too low at the same time.
Mm-hmm. And what is the role of this glucose you're mentioning? Because some of us, when you hear glucose, it's the glucose we used to have back in the day. What is it?
It's what helps us to make energy. Okay, so when you eat something, the body will convert it, okay, depending on the food type that it is. We know broadly there are about 3 to 5 most common food types. Mm-hmm. For example, carbohydrates, we have your vegetables, and you have protein. So all of these have some level of glucose, okay, they have some level of energy, but what is most common, what produces the biggest load of glucose or energy in the body is carbohydrates, or what we call starch. Mm-hmm. So glucose is what helps us to maintain the body functions. For example, if you want to stay warm, to maintain your temperature, to think, to move around, to exercise, all that needs energy, and this energy comes from glucose.
Mm-hmm. Okay, and now we move to the types of diabetes. What are some of the types, and also can you just explain a little to our viewer?
Okay, so as we said, diabetes is a disease of blood sugar control. Okay, it happens mostly because of 2 reasons. The first reason is that your body is not making enough insulin, and we said insulin is what you need for you to control your blood sugar. And the second reason is because of something we call insulin resistance. So that means your body is making some insulin, but the same body, for one reason or another, is not able to detect or recognize the insulin that is being produced by the body. There are most commonly 2 types of diabetes, but there's also a third kind that most people don't know about. Mm-hmm. So I'll focus mostly on the 2 most common types. The first type is called type 1 diabetes. We have type 2 diabetes, and we also have something else we call gestational diabetes. Type 1 diabetes is rare, it's less common, and we see it mostly in young people. Type 2 diabetes is the most common. It's a lifestyle disease, if I can put it that way, because it comes from the things we do in our lifestyle that bring about the risk for diabetes. Then the third one, also less common, is what we call gestational diabetes. So this is mostly associated with pregnancy, and for most people it goes away soon after giving birth.
Okay.
Yeah.
All right. And I've heard you mention the blood sugar. What should be the ideal normal blood sugar level?
So for the layman, we say 4 to 6. Okay, so this is the blood sugar that is measured first thing in the morning before you have eaten anything. Mm-hmm. And preferably, we say your last meal should have been dinner the night before, maybe 9 o'clock, 10 o'clock, and in the morning, not later than 8 o'clock. Because again, after 8 o'clock, so your body gets a little bit of stress, and whenever you're stressed, your blood sugar goes up. So preferably fasting in the morning before breakfast, so 4 to 6.
And when you look at the different types that you've mentioned, let's categorize, for instance, the youth and the young children, women and men. Who fall into which category the most?
So depending on the types, you are at risk of different types of diabetes. If you're 35 years and older, you're likely to get type 2 diabetes, which is the most common. Okay. If you're younger, because we've seen children who are 2 years old, 3 years old, some of you got it maybe at 4 or 5 years, others. So for children, people who are below 18, there are 2 sets, there are 2 age groups. So you have the under 5s, and then you'll also have the teenagers, okay, the around 16 to 18 years, which are the 2 most common groups that will get diabetes. Okay. Then for the third type that we talked about, the gestational, that is always associated with pregnancy. So it will have to be the women of reproductive age.
Okay. Probably just now mention to us some of the risk factors of diabetes.
Okay, so risk factors means the things that you do, the things surrounding your lifestyle, which can be modified and which bring about the high chances of you having diabetes. Okay, I call them modified because they are things we know you can never change. For instance, being male. Okay, although nowadays some people can change that. Your gender, you cannot change. You cannot change your age. You cannot change your race. Okay, but there are things you can modify about your life. For example, the activity level, what you eat, your weight. Okay, those are things you can modify and which can reduce the risk factors for diabetes. So risk factors for getting diabetes, and for risk factors mostly here I'm talking about the things you can modify, because for type 1 we know it's something that is genetic. It comes in families, it runs in families, so you can not modify that because you are born with it. But for type 2 diabetes, the most common type, and even gestational diabetes, it has to do with your lifestyle. And when you talk about lifestyle, this has to do with what you eat. Okay, if you eat so much and you end up with obesity, for example, that's already a risk factor for diabetes. And how do we diagnose obesity? You just stand on a scale. Okay, that's one. But the most common and the most preferred is we measure what we call your waist hip ratio. So we measure the circumference of your waist and also the circumference of your hips. Okay, and based on that we're able to tell you have obesity. Another risk factor is a sedentary lifestyle. Sedentary means you sit down a lot or you lie down a lot, and nowadays as we continue with urbanization, we see more and more of our jobs are becoming sedentary. Okay, more and more of the works or the jobs in the industries are mechanized. So people are less often going to the farms and doing manual labor compared to before. Another risk factor is just lack of exercise, okay? And that is different from lack of physical activity, because sedentary lifestyle simply means you sit down a lot, more than 3 hours, 4 hours continuously in a day. That's already sedentary lifestyle. And we know there are other diseases that are associated with that. For example, hypertension, okay? We also know nowadays, they say, having a sedentary lifestyle is the new risk, like equally to smoking. Okay, lack of exercise is one thing. We usually recommend that everybody should exercise at least 3 to 4 times a week, 30 to 40 minutes. And exercise means you break into a sweat, you feel your heart rate increasing, and you really feel like you've exerted yourself. You're expending energy. Okay, some people will say, well, I walk every day, or I'm on my feet the whole day, or my work is manual labor. That doesn't count as exercise, because as long as your body is used to it, then that will not be exercise, because your body is already not adjusting to it anymore, because it's what you do on a daily. Yeah.
Okay, so now with that in mind, what are some of the common symptoms of diabetes?
So most people who have diabetes don't know they have diabetes. And so by the time they come to the doctor's office, they will present with certain symptoms that make us suspect, okay, this person might be having diabetes. Oftentimes it will be many months or years after they have the diagnosis, but do not know about it. So the first thing that somebody will complain about is weight loss. Okay, although we said being overweight, being obese is a risk factor, but when diabetes hits, the first thing that happens is you have a few weeks to months of rapid weight loss. Second thing is increased thirst. Okay, so you always wanting to drink and drink and drink water, drink sugary drinks, and it's not enough. Okay, and because you drink a lot, you also pee a lot. Okay, so most times we ask you, how many times do you wake up at night? And someone will say, oh,
5 times.
I wake up 5 times, 6 times, 8 times, even during the day. Okay, another thing is increased appetite for food. Okay, so you're not only are you thirsty, but you're eating a lot, and you're losing weight, and you're going to the toilet to urinate a lot. Okay, those are just a few of the most common symptoms that will point us towards maybe this person has diabetes. Yeah.
All right, Daktari, and with that, allow me to now introduce our diabetes champions and have at least some of you tell us some of the symptoms that you might have experienced. So we begin with Ahmed. Hi, Ahmed.
Hi, thank you. I'm Ahmed, diabetic champions, as you said. And some of the things that I have experienced is increased thirst. As the doctor said, you feel like taking water every now and then, whereby you will see that it's not enough. The other thing is weight loss, and I can say unexplained weight loss. You feel like you are losing your weight, but you will realize it is because of you are not maybe managing your diabetic well, and it will lead you to lose your weight. There is frequently urination, maybe when you are diagnosed as a diabetic, and when you are hyper, maybe your blood sugar level is up, you will experience frequent urination, whereby after maybe every some minute you run to the toilet, you urinate, you come back, and sometimes even controlling your urine will be a problem.
Was a problem, yeah.
Yes, because of the situation or maybe the diabetic. And without taking much time, the other thing I can add is fatigueness. You always feel tired. Whenever maybe you are a hyper, that's one symptom that you will feel, tiredness. Thank you.
Okay. All right. Thank you so much, Ahmed, for those views. Let's also have the views of Cynthia.
Hello, my name is Cynthia Lusa, diabetic champion. Okay, some of the other symptoms are blurred vision. You get yourself, like the distance you used to see far, like you can't see far. You just see objects that are near. Then numbness, you can also get numbness. Sweating, a lot of sweating. You get yourself like you sweat a lot, like not normally. Then also you get hungry all the time. All the time you just want to eat. You eat and eat and eat. Okay. Then you also like you get yourself like you're just tired. You don't want to do anything. You just want to sleep every day. Like you're just weak. Yeah. Okay. Those are the symptoms that also occurred to me.
All right. Yes. And by sweating a lot, do you mean at night or during the day?
Mostly at night. Yes.
All right. Okay. That is a good head start where we have now dealt with what is diabetes, the symptoms, some of the risk factors, and we take now a short commercial break, but we will be right back. And before I leave you, let me leave you with the facts and myths board of the day.
No one in my family has diabetes, so I won't get the disease. It's true that having a parent or sibling with diabetes increases your risk of getting diabetes. In fact, family history is a risk factor. However, many people with diabetes have no close family members with diabetes. can stop taking diabetes medicines once my blood sugar is under control. Diabetes is a progressive disease, and over time, even if you are doing all you can to stay healthy, you may need medicine to keep your blood sugar within your target range. It is not safe to exercise with diabetes. Getting regular exercise is an important part of managing diabetes. Exercise helps boost your body's sensitivity to insulin.
I'm back. You are watching Body Garage, and on this episode we are delving into diabetes. And just before the break, we have learned what it is, some of the risk factors. And Doc, now just tell us, how common is diabetes?
Diabetes is very common. There's a study done in Kenya in 2023 that found that half of the people, more than half, 52% of people with diabetes don't know that they have diabetes. It's only when the complications happen that people seek help from hospitals, and that's when they are diagnosed. And that's simply because we don't screen. Nobody says, okay, I'm 35 years old, let me go and check if I have a problem with my blood sugar, a problem with my blood pressure. We often don't do that. Yeah, people don't just do health checks as often as they should. Yes.
What do the statistics look like in Kenya, perhaps?
In Kenya, at the moment, what we have is about 5%, which is an increase, because in the previous years, from 2018, it was around 3 to 4%. So we are seeing a rise in the numbers of diabetes. It could be because we are diagnosing more, so more people know about this condition, but it could simply also just be because of our lifestyle. Okay, because we say diabetes for most people is a lifestyle disease, and like I said, with urbanization, we're less physically active. Okay, when you look at our modes of transport, when you look at the jobs that we do, for example, if you're in social media, you can sit a whole day without noticing that, well, several hours have passed. Okay, we are walking less often, we are not exercising, and even the diets that we are eating, the food that we're eating is mostly highly processed. So because of that, there's going to be more diabetes than what we are seeing today.
Okay, and I know someone is watching, has had these symptoms that we've mentioned, and is wondering, so then what are the causes of diabetes?
So if you have increased thirst, increased hunger, so you're eating all the time, you've lost weight without intending to lose weight, so you're not on any diet and you're not exercising, if you're urinating a lot more than usual, plus all the other minor symptoms we've talked about, like fatigue, irritability, then you need to check for diabetes. I know you've asked about what causes it.
Yes.
Depends on the type. For type 1, we've said it's an autoimmune disease, meaning it's the body's own immune system that is affected, and so you end up with diabetes. For the other two types, the gestational and the type 2 diabetes, it's mostly lifestyle. Okay, so having those risk factors, which also includes having family members with the same type 2 diabetes, especially what we call first degree, so your own parents or your siblings. Yeah. So if they have diabetes plus the other risk factors we've talked of, such as obesity, a sedentary lifestyle, lack of exercise, and a not so good diet, those are risk factors.
When I was growing up, I remember my mama used to be like, do not take a lot of, soda, a lot of sugary stuff. It would cause that. Is that true?
It depends. We know countries like Italy, where people love chocolate, they love ice cream, they love sugary foods, but they live to 100 and beyond.
Yes.
And they don't have as many cases of diabetes as the rest of the world. Actually, the continents that are leading for diabetes are Africa, Asia, and South America. And the issue with sugary foods is really about moderation. How much of it are you taking? Sugar is not a problem, it's the portions.
It's the portion that
because we've seen people who don't take sugar at all, but how much other forms of glucose are they taking? What's the size of ugali on the plate? or what's the amount of rice or the fries that they're eating in comparison to the rest of the portions for vegetables or the portion for protein. Okay, so that's where the problem is, because even if you eat no sugar, but the carbohydrate amount that you're taking is a lot, that still gets converted to the same glucose that you would have taken in a bottle of soda or juice.
Okay, all right. Now let's look at what are some of the complications of diabetes?
Complications of diabetes are many, but in general there are about 5 common ones, and these ones we see them after several years of having diabetes. Unfortunately, most of the patients who come, they come in only when they are beginning to get some of these complications, and we said half of the people don't know that they have diabetes, yet they have it. So they will usually present 10 years after they first started having symptoms, others 15 years. And generally we say by the time you're seeing complications of diabetes, 15 years will have passed, roughly. Okay? If you had type 1 diabetes when you were 2 years old, 15 years later means, or if you're 5, for example, 15 years later means you're 20. Okay? So the complications we see in someone who is 70 or 80 who got diabetes at 50 are the same ones we'll see in someone with type 1 who is 20. Okay? So what are these complications? The first one is kidney failure. Okay? Because diabetes affects several parts of the body. One is the kidneys. Okay? So you find your kidneys are functioning less and less efficiently compared to normal. Another thing is what we call microvascular complication. That means your extremities. So you have numbness. I know someone talked of numbness on the palms and the soles of the feet. That's just one of the complications. And how we commonly see it is wounds. You find people with chronic wounds that just don't heal. Sometimes they end up with amputation of their legs because of complications of high blood sugar. Okay? Another complication is heart disease, and very commonly people get heart attacks, or they end up, which can complicate further to heart failure because of diabetes. Another very common one is eye problems. Okay? After several years of diabetes, you don't get good blood supply to all those organs, including the eyes. And so with time, you find you might require glasses. Okay? Fortunately, most of these complications are treatable. So you don't have, if you are diagnosed early or if you follow up with your doctor constantly or regularly, some of these complications can be dealt with or at least prevented.
All right. At least we do have a live audience here that can tell us some of the complications that they have probably experienced. And so, Gilbert, hi, how are you?
Hello. For the complications, maybe I have not let myself down that much to the point of heart disease and what the doctor is talking about. But I've had instances where my work productivity is very low because of the fatigueness. At some point, I had my sugars uncontrolled, and I was feeling the numbness in the leg. That went for 2 years before even I got diagnosed with diabetes. And during that time, when I had the uncontrolled sugars, my bruises will take longer to heal than normal. And for the urination and the dust, I could not travel far from where I live. So I decided to go to Kisumu. I was using public service. So I had to stop the driver every single time. Some of the passengers obviously were not very happy, but there was a woman there, and an old lady, and she kept fighting the driver, allow him to go. So I was happy because of that. And obviously I have received massive support from family and friends and doctors. So now I'm better and I have controlled sugars.
Yes. Thank you for sharing that with us. All right. Now, do these complications differ to someone with long-term diabetes?
So we don't have what we call long-term.
Or there is not? Okay.
The only type of diabetes that fortunately may go away for most cases is the gestational diabetes, but the symptoms are the same. Yeah, because it's just about the age and what brought it along, but when it comes to symptoms, they all present with the same symptoms. For gestational diabetes, soon after giving birth, majority of them will have the diabetes go away, but a small percentage will have it persisting. So whether you have type 1 or type 2 or gestational, it's all diabetes. Okay. Of course, the effects are different based on your age. When you're older, also you find you have other comorbidity. So other conditions like heart disease, or you have hypertension. There are other conditions or issues with bones like arthritis, okay, which might affect the medications that you take and your overall health. Yeah, so the symptoms are the same. It's just the age that might present some differences.
All right. Now, a person has presented the symptoms. They come to your office. How do you diagnose them?
Okay, so the first thing we always do is take history. So we ask you, do you have these symptoms? And someone will say, okay, I'm here because I feel thirsty all the time, or I've lost a lot of weight, or I urinate so frequently. Others will come because they have a wound that has refused to heal. Okay, so based on that, we ask to do some tests. Yeah, first we'll of course do a full body check, and then recommend some tests. The most common test is a blood sugar test. Okay, there are two types that we mostly use. The first one is the fasting blood sugar. That's the finger prick, but you need to have come not having taken breakfast. The second one is called glycated hemoglobin, or HbA1c. It's a blood test done in the labs. It shows us how your blood sugar has been, how well controlled or how poorly controlled it has been over a space of 3 months. And that's usually very good because it gives us a true picture of whether this is truly diabetes or just some other acute cause of high blood sugar. Many people in the past, before we had this test, this is a new test that's been there for nearly 10 years. But before that, it was very easy for patients to just come to hospital and they stop all the things they've been eating poorly, which they're not supposed to eat. And they come and the sugar looks fine, but that's a lie because over 3 months or longer, they have not had good sugar control.
Okay.
Yeah. Other tests that we do have to do mostly with complications of the diabetes itself.
All right. Now you've mentioned that when you're taking these tests, someone should come not having taken breakfast. Why is that?
Because if you just take breakfast, then we are measuring the blood sugar at that time of that specific meal. Okay. But we know that insulin works to regulate your sugars over several hours. And so we do not want a false result. Someone that has just taken a soda versus someone who ate maybe a fruit versus someone who ate maybe just a small piece of starch, their blood sugars will be different, right? So it's easy to falsely diagnose someone with diabetes based on what they have just eaten. Yeah.
Okay.
But for pregnant women, usually we have a test called the glucose challenge. So you come having not eaten, then we give you glucose and measure your blood sugar at the start, before the glucose, at 30 minutes, and also at 2 hours after the glucose challenge. And that also helps us to know better whether you are at risk or whether you already have the diabetes.
All right, now let's get to hear from Elizabeth, who is going to tell us how she was diagnosed.
Okay, hello, my name is Elizabeth Mureithi. I've been diabetic for 12 years now. Okay, when I was diagnosed, before maybe the diagnosis, I first went to the hospital and I was treated for malaria because I was vomiting a lot, I had headache, and I was drinking water a lot and even urinating a lot. So the first doctor actually gave me drugs to take for malaria. So I stayed for like 2 weeks, just taking the malaria tablets. After 2 weeks after that malaria diagnosis, is when my mom just noted I've just started being weak, and she said, let me take you to another hospital. So when I went to that hospital, when the doctor was told the symptoms, the first thing he did, he said, just check her blood glucose. And my first blood glucose was reading high. The machine read HI. That means it was so high. So after that, I think I went for into a coma for some days. Then now is when I was told I'm diabetic. And I've been managing it since then. That was 2012.
All right.
Yes.
Thank you so much, Elizabeth, for your courage and for sharing that. And you give a lot of people hope by just sharing your story. Asante sana. Yes, as you've heard, we have just discussed some of the complications as well as how diabetes is diagnosed. We take a short commercial break. When we will be right back, we will deal on the treatment and the management of diabetes. Do not go too far. Thank you so much for staying with TV47 on this episode of Body Garage, where we are discussing diabetes. And with us in studio, we do have diabetes champions and as well as Dr. Stella Kibet. Thank you guys for coming through today. Now, let's start with Gilbert. What is your question for Doc?
How does uncontrolled sugars affect maybe sex drive?
Oh.
And if it does?
Right.
Yes, thank you.
Let's take another question from Cynthia.
My question is, if you're a diabetic, like lady or a woman, and you want to get like pregnant, how can you prevent your unborn child from getting affected? Yes.
All right. Thank you, Elizabeth. Let's get another question from Joy.
Thank you. My question is about DKA, diabetes ketoacidosis. The possibility of getting DKA even after using insulin, like, is it possible? Like, does it occur? Yeah, that's my question.
All right. Do we have any other question? No. All right, Daktari, you've had the questions. Let's begin with Joy's question.
Okay, Joy, you've asked about DKA. So DKA in full means diabetic ketoacidosis, and it's what Elizabeth you had. So it's one of the complications of diabetes where somebody presents and sometimes they go into a coma, okay, because their blood sugar is so high that the machine says unrecordable. And usually that's 30 something and above. So high that you cannot detect or record it anymore. The reason why people present with DKA, that complication, is because most of the time they don't know that they have diabetes, and most commonly it's seen in type 1 diabetes. And because of that, because they have no insulin anymore in the body, there's no regulation, there's no control, so the sugar goes so high, and there are other complications that come with it. You've asked whether after being diagnosed of diabetes, after maybe having your first episode of DKA, whether you can still have it again when you're on insulin. The answer is it depends, but is it possible? Yes. If you're not complying with your treatment, and all of you know, if you are type 1 diabetic, you must be on insulin lifelong. There are no two ways about it. There's no other option, okay, for now. So if you're no longer on insulin, and insulin comes in many forms, I think we'll talk about it later, but if you're not complying, or your insulin maybe is expired for some reason, or it's not working well, or the dose needs to be adjusted but it's lower than usual, yes, you will get highly unrecordable sugars, and that can precipitate DKA. So it's possible to still get DKA even after you are already on treatment for diabetes.
Now we go to Elizabeth's question of preventing your unborn child from getting diabetes. Is it transferable?
Well, if you end up with type 1 diabetes, it's something that's genetic, okay? It runs in families. So can you prevent it from happening? Probably not. But some things that might help, because it's about inheritance and it's about probability. Yeah. So if you put somebody who has the genes with another person who has the genes, chances are it might transfer to the child. Now, whether or not that child gets diabetes truly depends on just probability. So there's nothing you can do about lifestyle or something else to modify that risk. So really the only thing you can do maybe is just to ask, is your partner really, there's nothing else.
Yeah.
Because it's not modifiable. You're born with the genes, and for some people they get the disease and some don't get it. Yeah.
Is there a way to find out if my partner has those genes?
It's hard to tell. People do genetic tests, but those are not really recommended. The best way is just to find out if you know who your family members are, because we know there are people who don't have family members, or they are adopted, or they cannot trace their family, so it's hard to tell. But for most of us who can tell who our family members are, that's the only way to know. Yeah.
Okay. Gilbert asked, how uncontrolled sugars affect sex drive?
Yeah, that's an important question. Like I said, there's something called erectile dysfunction. This is a complication, okay? Most people think of it as maybe a psychological problem, but the truth is it's a cardiovascular problem. Cardiovascular basically means how your heart functions and how it pumps blood through the vessels to the rest of the body, okay? Remember how we talked of diabetes causing wounds and nerve problems to your extremities, to your hands and legs? It's the same. You need blood supply to be supplied to your sex organs for you to be able to function, okay? But if this doesn't work because your blood vessels have been damaged, remember these blood vessels supply your feet, your extremities, your eyes, your hands, okay? If blood cannot travel to those places very well, then you end up with erectile dysfunction, okay? Erectile dysfunction in people who have diabetes is a blood vessel problem because of the destruction by diabetes. For other people who don't have diabetes, it could be because of high blood pressure. And high blood pressure is also a complication of diabetes. Other things could be smoking, and for others, psychological. So it depends on who is your partner, how do you feel about the partner, have you changed, okay? So those are the things that can affect your sex drive. So it's very, very important that you control your blood sugar, because if that's not controlled, then you have all these other complications. And unfortunately, for some of these complications, they cannot be reversed. If the damage has already happened, you cannot take it back, but with good control, you can prevent further damage from happening.
Thanks, Dr. for those insightful answers. We will be taking more questions as the show goes on. Now let's delve into the treatment and management part of diabetes.
Right. So diabetes, again, because you said there are two types, broadly speaking, the type that requires insulin, so what we call insulin dependent diabetes, which is mostly type 1, and the non-insulin dependent, so the ones you can control with other means, okay? Over time, for the type of diabetes where you can control with diet or with oral medications, tablets, over time, if you've had it for very long, you may end up depleting all the insulin in your body, and in that case also still require insulin. Okay, so for insulin, for those who require it, mostly type 1 diabetics, because their body cannot produce insulin anymore. And the second group are those who've had the type 2 diabetes for many years, and now still the body is no longer able to make any insulin at all. For insulin, it's a hormone. It's synthetic. You inject to your body before meals, and then after you eat, it helps to regulate your blood sugar so that it doesn't go too high. There are many types, and many, depending on how well you're controlled, you may be given those different types. There's also the type of diabetes that you can control with just diet. That's diabetes that has been discovered early enough, and where there are many things you can modify. For example, weight. So we tell you to exercise, to look at the kind of diet you're eating, reduce stress, okay? So those are some of the things we can recommend. And with that one, all we need to do is just frequently checking your blood sugar. Then there's a third type. We talked of oral tablets, for example, metformin, which you take maybe twice a day or sometimes even once a day. And you can be on 2 or even 3 different types of medications, or which you take orally for the diabetes. There are others also who eventually, when they require insulin, will still need to be on insulin together with 1 oral tablet for the blood sugar control.
You've touched on the diet. Whilst you're advising someone who is seeing you and is having diabetes, are there some foods that you tell them to avoid?
Yeah, generally speaking, because your body is not producing insulin as it should, if you give it too much glucose, yeah, then that becomes a problem. Okay, so generally speaking, we recommend a healthy plate, which all of us, whether you have diabetes or not, should be eating. And that means on your plate, half of it should be vegetables. Okay, then the other half divide into 2, where 1/4 is protein and the other 1/4 is starch. Okay, starch means things like maybe your potatoes, your rice, ugali, and so on. Okay, the vegetables, usually we prefer dark green, but even raw vegetables are very good. Every day you must also take fruit, and that's a slice. Okay, a slice of fruit. That means not more than your fist. Okay, some fruits have lots of sugar, like watermelon, some apples, carrots. If you eat them as fruit, some mangoes, they have a lot of sugar. So we usually say you can take it, but in moderation. Okay. For others, when their blood sugar is not very well controlled, we tell them not to take it all together for some time.
For some time.
Yeah.
Okay. And when you're managing it now with insulin, what areas of the body does someone now inject themselves the insulin?
Okay. Most people will inject it on the arm. Okay. For others, on the thigh. And usually they'll be taught. So there are many things we do. When you first come and we tell you have diabetes, chances are we will not start you on treatment that day, because this is a lifelong condition. This is something that will be with you forever for some cases. And many people have problems accepting that. Many people have problems accepting to take insulin, even if it's the only thing that will help them. And so we take you through counseling, make sure you accept it. We talk about diet and the clinical visits, and the last thing we talk about is the insulin. So when you come, we teach you. These are the sites where you can safely inject. So the thighs, the upper arms, and for some people, around the abdomen. So usually we try to avoid places where there are blood vessels. We try to avoid places where there are joints. Yeah, so that you reduce the risk of complications.
All right. Thank you so much, Doc, for that. Now we would like to hear from you. How is it living positively with diabetes? Let's begin with Joy. How has the journey been?
Thank you. To be honest, living with diabetes is not easy. Acceptance really goes a long way. The moment you don't accept that it's here, it's with you, that's why you mess everything up. It was a really hard journey, accepting. Change is constant, and change goes a long way. When you're born with diabetes, then that means when you're growing up, it will be easier for you. But then when it's like meets you like on the way, like you're growing and then you're diagnosed with it, then that means you'll have to adjust to fit in with every other person. And I'd say we are not so different from other people. The only difference that comes in is when your pancreas is not working.
Okay.
But now, what do you have to do like to be like the other people? You have to take your insulin. You have to be disciplined. You have to. The don'ts are actually a lot, because if you tell me, Joy, don't take chocolate, that's a lie. That's a lie.
You must take your chocolate.
I have to take my chocolate. You see. But now I feel like you can take it, yes, but as Dr. has said, portion meals. you just don't take like it's a last supper, it has to end.
Yes.
Yeah. And I've mentioned acceptance, right?
Yes.
Acceptance is not only personally, even the family members, your friends, and every other person, because you get the instance of like a family member hasn't accepted like you're diabetic. You get like someone is telling you don't go out, you're sick, something might happen out there.
All right.
Don't do this, you're sick, you know. So it's not easy, but every day you get to learn how to live with it.
Thank you so much, Joy. For about 30 seconds, Albert, share your experience. How has it been living with diabetes?
I got diabetes when I was 2021 in Form 2. And it was really heartbreaking for me at first. And I think it changed my life. And not just personally me, even my family and the bigger part of it. And having diabetes for me, I think it was a stepping stone for me to greater heights, because everybody thinks that when you have diabetes you can't stay for long, you're not supposed to do certain things, but for me I prove them wrong, because I tell people the only difference between me and you is that you have your insulin in you, I have to carry mine everywhere I go. So that's the only difference for me. And to any other person out there watching, I would like you to take that as a mentality, because if you put the mentality that people want us to want us how they want us to be, you won't go far with it. And the best and the biggest step one can take, as Joy said, is acceptance. And this is the biggest milestone that so many people don't want to take that step of accepting it, and even wanting the urge to continue managing it.
All right.
Yes.
Thank you so much, Albert and Joy, as well as everyone else who has shared their experiences. It has been a lesson, and thank you for being courageous, everyone. So, Dr. Stella, perhaps your final remarks on how should then I prevent myself from getting diabetes?
So, diabetes is preventable for most people. It's a lifestyle disease. So how you carry yourself, how you take care of your body really matters. So if you reduce the risk factors that will cause obesity, for example, diet, if you exercise, if you opt to take the stairs and walk instead of riding on a matatu or a boda, those are small changes in your everyday lifestyle, but which make a huge difference. If you pay attention to how much time you've been sitting or lying down, it makes a difference. Yeah. So one of the tips would be drink water more, because when you drink water more, what do you have to do? You have to go to the toilet. So you will not be sitting for 3 hours continuously and not move around.
Okay.
You have to be intentional about exercising. Make time out of your daily schedule or your weekly schedule to be intentional about exercising. Because as we know, in Kenya, most of our environments, compared to other places like Europe or the developed world, they're not adjusted to help us walk more. They're probably not safe. How many estates in our communities have walkways for us to say, well, today I will not take a matatu or a bus, I will not drive, but I will walk home and I'll be safe at 8 p.m. okay, or at 6 a.m. okay? Insecurity is something that has to be dealt with. Another thing is just educating yourself more about some of these things that you can adjust around your lifestyle. Sugar is hidden in a lot of the foods that we eat. Okay, so when you educate yourself more and start to consider what's on my plate, what am I eating today, paying attention to those small details can make a big difference eventually, whether you have diabetes or not. About positive living, if unfortunately you already have diabetes, you need to know there's really nothing different other than I don't have diabetes, you have diabetes, but we all have insulin, the source is different. Okay, so exercise will really help, because one of the side effects of using insulin is weight gain.
Okay.
So you find you only eat so little, but you keep on gaining weight. So how do you fight that? You exercise. Okay, strengthen your body, strengthen your muscles, and with that you'll find even your mood will be better, your energy levels will be better. Focus on what's on my plate that will really help you. There's a lot of stigma, unfortunately, in our communities for diabetes, where there are restrictions. There are people who hide, even in toilets, to inject insulin, because people will look at me funny or they'll ask me a lot of questions. People limit their social interactions because they have diabetes. They say, well, I can't go out because when it gets to 7 p.m., I have to inject. What will people think about me?
All right.
There are people who are pilots, others are doctors, and they've had type 1 diabetes for many years, and they're living positively and achieving everything that they desire and having ambitions. Okay, so when people know that, that makes a difference. It's very easy to get into anxiety, depression, just because you mark yourself as diabetic.
Yes.
But when you have support groups like what we have today, when you educate people more, then you can live positively.
Yeah. All right, thank you so much, Daktari, as well as thank you, my diabetes champions, for sharing your stories. It has been a lovely episode, and as you've all heard, this small, paying attention to the small details can actually make a difference. And so with that, I leave you, but we will see you next week. I am Sheila Chelangat. Thank you for watching.